Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Today, the continent celebrates Africa Day 2020 amidst COVID-19 pandemic. Patients discharged from isolation center in Edo State tell their stories and encourage citizens to go for testing. And Japan lifts state of emergency after announcing bringing coronavirus under control. Well, the coronavirus is still ravaging the world as extraordinary measures to fight the pandemic continue to prevail around the globe. Other than the public health impact across the African continent and others, the number of deaths across the board has seen sweeping executive powers by governments who have imposed emergency measures and how to limit their long-term impact of COVID-19. But more fundamentally as well is a pandemic that is testing the strength and resilience of our political systems. With over 50 elections postponed across the globe so far, and 19 haven't gone ahead in unclear times, bringing concerns of some global leaders as to the legitimacy of democracy itself being challenged. On our theme this evening, we'll look at the task of living with the coronavirus. At about 19 hours ago, 313 new confirmed cases and 5 deaths were recorded in Nigeria. Those deaths were recorded in the following states, 1 each in Delta, Edo, Ogun, Rivers, and Sokoto. The new cases were confirmed in 17 states of the Federation, bringing the total number of COVID-19 infections in the country to 7,839. The Nigeria Center for Disease Control, NCDC, also put the number of patients discharged at 2,263 and the total death toll at 226. A look at the breakdown of the figures by region shows Lagos leading in the southwest with 3,505 confirmed cases. Lagos is a state that has discharged the most patients at 658. Next highest is Kano State in the northwest, and when you add its active cases at 727, the number of discharged at 133, and the death toll in the state at 36, it gives you a total of 896 cases, as you can see there on your screen. Now, the Federal Capital Territory in the North Central region is in third position with 505 cases. Borno leads in the northeast with 250 cases, Edo in the south-south with 191, and Ebonyi overtaking Enugu in the southeast with 33 cases. And as Africans at home and those in diaspora mark the Africa Day 2020, former President Goodluck Jonathan is calling on African leaders to work in solidarity and unity of purpose towards overcoming the current challenges of the continent. Speaking on the COVID-19 pandemic and its effect on the continent's democracy and governance structure, Dr. Jonathan says, as many of our nations battle with the emergent threats posed by the outbreak of COVID-19 pandemic, we reiterate the need for leaders and all Africans to demonstrate solidarity and work together towards overcoming the challenges of poverty, insecurity, conflict, and the proliferation of small and light weapons. He explains that at the heart of the continent's development challenges are issues of poverty, electoral fraud, violence, and political instability. He believes that political and democratic systems will be tested beyond their normal limit. Recently, in a webinar organized by the Kofi Annan Foundation, the former president noted that many African nations may not be able to organize periodic elections because of coronavirus-imposed restrictions. And 4 months and 11-month-old babies, including a 15-year-old child, are among newly discharged COVID-19 patients in Bauchi State. All 27 health workers, except one infected with the virus, have also recovered and have been discharged from the isolation centers. The Commissioner of Health, Dr. Aliyu Maigoro, told Channels Television that the state has recorded 80% success rate in case management so far, and only about 40 patients out of the over 200 positive cases in the state are receiving treatment, and the ratio of men to women infection is 70 to 30. Dr. Margaro also confirms that the health team is managing the case of a pregnant woman who is due for delivery any moment. Well, joining us now from Edo State is our correspondent, Hajira Aliyu, who also talks about the cancellation of the Durbar. Hello, Hajira.
Has altered one of the most exciting rituals of Eid, the annual Durbar festival. On this day last year, this stretch of field in front of the Emir's Palace was bustling with procession of horse riders, but today it is different. Some of the major elements of the Durbar, the Emir, the spectators and the horsemen are missing. The cancellation of the Durbar has happened 4 times in the past. The first time was after the demise of the late Prime Minister, Sir Abubakar Tafawa Balewa. It also happened 2 other times after the demise of 2 prominent persons in the state. And in 1990, during the attempted coup d'etat, it was cancelled due to the tension in the country at that time. Today, a global health crisis has warranted the cancellation of the Durbar, which would have been the 106th Durbar festival in Edo State since its commencement in 1914.
There are 19 districts in Bauchi town alone, and all of them will come from the town, from their villages to headquarters for Durbar. And all our women and children, about 7.5 million people, will come out to watch the Durbar. And then our children, youth, they will go out in a playing ground near the Emir Palace in Azare, Bauchi, Misau, everywhere. They come out and enjoy themselves. So we saw that gathering is being worst. So we decided the governor should cancel that gathering and should not allow any Durbar, because by the time you gather like that, there will be no social distance.
From Edo State, Hajira Aliyu for COVID-19 updates.
Many thanks, Hajira. So it's a long-term impact of COVID-19, and we are going to analyze this now. Joining us in the studio is Dr. Imedim Fon Okon. She's the current chairman, NMA National Committee on Protocols and Programs. Also, apart from being a field epidemiologist, she is also the NCDC Lagos State COVID-19 Rapid Response Team. Glad to have you on the program.
Hi, Millicent. Happy Africa Day.
Thanks. Same to you as well. Talking about the day, let's start with what you think about Africa, if they've been affected differently by the pandemic.
Well, we've not actually been affected differently. What I would just say is that we've had infectious diseases quite a while, and we've had systems in place to manage infectious diseases. So with these systems in place, when we had this COVID-19 come into Africa, it was managed on time with these systems that were already in existence. So I wouldn't say we were affected differently.
In terms of education about what this virus means, have we handled it appropriately? Because we've had several measures put in place to stop misinformation, and there appears to be some people who still don't believe that this virus exists.
A whole lot of work has been done in risk information and communication. But we still have a lot more to do, because just like you rightly mentioned, some people still do not believe that COVID-19 exists. And because of that, they're being a bit careless about these precautionary measures that are being advocated for preventing it. You know, the kind of health systems we have, especially in Africa, our health systems are not that strong. So it's better for us to take precautionary measures rather than wait to come down with the diseases, because we may not be able to handle it because our systems are not that strong.
Some public health physicians say that our infection rates and cases are underreported. Do you agree with this?
Well, underreported because the more you test, the more you're likely to discover. So we've ramped up our testing capacity now, so we're seeing more cases. So I wouldn't say underreporting per se, it's just that if you test more, you'll be able to discover more cases. So we're doing that now, and we're increasing our testing capacity. So we'll definitely see more cases, as it were. We'll be able to discover more cases.
If you compare that with how Nigeria is doing to other countries, say South Africa, the president today said that the outbreak will get worse as soon as they try to ease restrictions, which they're looking forward to. Ghana has imposed a 3-week lockdown and is looking at easing restrictions as well, saying that, the country can't be on lockdown forever. Nigeria has since eased restrictions. We're seeing more cases each day, and we're at par with testing, not testing as much as we should with our population. Are we making progress or are we retrogressing?
We're not retrogressing. We're definitely making progress. Like I mentioned earlier, as we test more, we're going to definitely discover more cases. But, as we are relaxing this lockdown, it is very important for us to increase sensitization and awareness and let people know the importance of these precautionary measures so that we don't have the surge that everybody is scared of. So that is just the worry about relaxation of the lockdown. Like they mentioned, I think Mauritius also, for about 3 weeks or thereabouts, they've not had any case. Then I think today they had like 2 new cases. So it's not good to relax too much, especially when it comes to these preventive measures. We know that prevention is definitely better and cheaper than cure, so we should emphasize on that.
How much do you think if we learned anything from the Ebola outbreak, and what more do you think we would learn with this pandemic moving forward?
Well, this pandemic, like one of my colleagues mentioned, is a classless disease. COVID-19 is a classless disease. It has affected everyone of different race, religion, tribe, and of course, class too. So it has affected everyone, and there's hardly any nation that has not been affected by this, such that nobody is traveling anywhere for any treatment. All of us are here. So many people by now have discovered the deficiencies in our health system. And I am hoping that moving forward, this is going to improve or strengthen our health system. So at least that would be one positive takeaway from this.
All right, we appreciate your time. Dr. Imedin Fono-Cohen, current chairman, NMA National Committee on Protocols and Programs. Thank you for joining us on the program.
Thank you very much, Millicent.
Over in Edo, some COVID-19 patients receiving treatment for coronavirus at the Stella Obasanjo Hospital's Isolation Center in Benin City. They praised the state government for what they describe as quality healthcare services being given to them. One of the patients who has been discharged shared his experience after testing negative twice for the virus.
As safety is the watchword, the Deputy Governor of Edo State, Mr. Philip Shaibu, and his team don personal protective equipment as they prepare to enter the isolation ward at the Stella Obasanjo Hospital in Benin City, the Edo State capital. Mr. Shaibu, who is also the chairman of the technical committee of the Edo State COVID-19 task force, leads the ward round. Outside the ward, the atmosphere is a happy one. More patients will be leaving the hospital after testing negative twice for COVID-19. Aliyu Suleiman is on this list. He shares his experience.
I've been here for the past 40 days. Today making the 40-day aspect in this place. So they have been giving us a free treatment. Gave us a food, morning, afternoon, evening without complaint. So whoever that is taking maybe the COVID-19 is a death warrant. It's not a death warrant. That is what I want to let the people know.
Your Excellency.
The Speaker of the Edo State House of Assembly, Frank Okiye, the state's index case, is another who knows a lot about recovery from the deadly virus.
I already went in for a test because I was just coming in from abroad, and before, and the test came out positive before the symptoms started coming on me. I had cough and a little bit feverish. I don't know what happened thereafter. Maybe I went unconscious, but I came out and fine.
The Edo State government insists that early detection is important for treatment to be effective.
Please, make yourself available for screening. And from screening, if you test positive, please, just don't lose hope. Just know that it's just one of those things. And that you are positive does not mean you are dead.
According to the Edo State government, the number of positive cases stand at 144 as of May 22, a figure that is expected to rise. Thus, complying with the COVID-19 measures put in place would be in the best interest of everyone.
Still to come, more on the global COVID-19 response when we return. Please join us again. Welcome back. Still looking at the long-term impact of COVID-19 across the world. Joining us for more on this is Dr. Adora Enechukwu. She's a GP Registrar, Emergency Medicine, Central London. Thanks, Dr. Enechukwu, for joining us on the program.
Thank you for having me.
Let's begin with what's happening where you are. Is London still the epicenter of the pandemic in England?
I think as one of the most densely populated cities, or if not the most densely populated city in the country, we are still seeing the vast majority of cases in London, but there are pockets in other sort of major cities, you know, Birmingham, Manchester, and things like that. But it is still more in London, although we're seeing a massive reduction in terms of cases and the amount of deaths as well.
Over the weekend, we heard about protests arguing against the need for restrictive COVID-19 measures imposed by governments, claiming that they evoke panic, infringe on people's rights rather than the public health measure that they're meant to curb. And this is across Germany and some parts of Europe. What's your take as a health worker?
I mean, I think you have to look at it from both angles. At this point, especially if people have been following lockdown guidelines, a lot of people have been self-isolating for, you know, about 9 weeks now. So I think what we're seeing a lot of is people's frustration. We've discussed mental health, you know, at various different times. And I think a lot of people are feeling anxiety and stress. And I think it is easy to feel as though your freedom is being taken away in a sense, especially if you look at all of those factors. I think the most important thing, though, that we have to reiterate is the importance of following government guidelines and staying isolated until we are told that it's safe. Regardless of how we feel, ultimately the most important thing is to put other people around you first, as well as yourself. So I think, you know, it's definitely understandable. I think we're all going through an immense amount of stress and strain. But the most important thing, I think, is to follow guidelines until it's safe and just to prevent that second peak, because that will be much worse for everyone.
If I may quickly ask about your thoughts about some of the allegations on Dominic Cummings and being asked to resign.
Yes, I think it's a bit of a tricky one. From my understanding of the case, he and his wife, you know, were unwell, and that was part of the reason why they were driving up. And I think also from the public standpoint, a lot of people are very, very frustrated. And when you look at the reasons why, it's because people have been following guidelines. There are lots of people who aren't, but there's a vast majority that I think are actually following guidelines. But because of that, they've not been able to see loved ones. People have passed away and been buried, and they've not been able to see their family or say last goodbyes or do things like that because they were following guidelines. So I think there is a lot of public outroar, as it were, because people feel very strongly that they have been following the rules and that the government who have put these rules in place do not appear to be following it. I don't think we have all of the facts with regards to why he went or how many times he went, and it's not really for me to speculate. But I think looking at all of those factors, coupled with the fact that people have been locked up for, you know, over 2 months, I think, you know, the public is very outraged, and I can understand why.
Now, Adora, talking about guidelines, Japan has come up with a model saying the world should emulate that has been able to reduce from 600, 700 a day of cases from mid-April to about 20, 30 cases last week. And the local explanations are that Japan's success was with the culture of wearing the face mask, obedience to government requests, and the effectiveness of the country's contact tracing system. What do you make of that?
Japan has done really well, and I'm hopeful that the UK can sort of follow in their footsteps, and Nigeria as well. I think initially there was some hesitation with regards to to advising people on face masks. And I think some of that did have to do with actual lack of equipment. But as of in the last couple of months, especially in public areas, so we're seeing, in the tube stations, trains, buses, people are being advised to wear masks. So we are sort of heading in that direction. And I think it makes sense. If you're in a crowded area, a public area, it protects others from anything that you might have, and it also protects you. And I do think it's important, and we seem to be heading that way, which is really reassuring.
Let's quickly get your thoughts. We hear that the Lancet has a new study that says the urgent need to evaluate real-world evidence related to the outcomes of using hydroxychloroquine, that the drug rather increases the chances of dying in COVID-19 patients. Is that any different from the care that the WHO has sounded with the use of hydroxychloroquine to treating COVID-19?
I don't think as of yet we've been given any firm answers with regards to either encouraging us to use it or saying that it can have a completely negative impact. The difficulty is obviously there's been a paper, but usually with these sorts of things we want multiple papers, and then we want to peer review them. It's all about the quality of the evidence, and I think that at this point there isn't enough evidence to say that it should be recommended. What we do know is that hydroxychloroquine, like a lot of other drugs, have lots of side effects that can be really detrimental to a lot of people's health. So that's one of the reasons why from the very beginning we were sort of strongly urging people not to take medication unless prescribed by their doctor.
All right, we'd like to thank you, Dr. Adora Enechukwu, GP Registrar, Emergency Medicine, Central London. Thanks for joining us.
Thank you for having me.
Let's go over to Yenagoa, the Bayelsa State capital, where our correspondent, Dobra Timiwood, brings us this update.
From only 2 cases on Friday, Bayelsa State now has 5 active cases for the coronavirus. Over the weekend, 4 new cases were recorded, while one of the active cases, whose result now came out negative, has been discharged. Now, with the rise in the number of infected persons in Bayelsa State, one would readily assume that residents of Bayelsa State would readily comply with the stay-at-home and social distancing ordered by the federal government. But a visit to most of the eateries and hangouts in Bayelsa State revealed that these places still enjoy huge patronage.
I was moving around while we were taking opinions, and the clubs have come back to function. You see, people are no longer maintaining safe distance, and they are operating as if there are no regulations in the state.
We have to call on the security agencies, both the conventional and on the unconventional security at our border, at our toll gates, to ensure that they step up their game in ensuring that they don't allow people that are not supposed to pass, people that are not essential duties, to come into our state.
The COVID-19 task force in Bayelsa State says they've noticed a trend that some of the new cases in Bayelsa State have an active travel history in spite of the ban placed on interstate travel, while others are essential service providers who may have contacted the virus in the line of duty. Dobra Timiwood for COVID-19 updates.
And the Japanese Prime Minister Shinzo Abe referred to his government's handling of the outbreak as a Japan model that achieved good results before acknowledging some problems and delays. It comes as the country lifted its nationwide state of emergency, ending restrictions in the remaining areas where the order was still in effect. At a press conference, Mr. Abe said that they had very stringent criteria for lifting the state of emergency and that they have judged that they have actually met the measures. According to the NCDC, taking ownership and collective responsibility is important as we fight the virus. You can find the latest guide on their website as the Centre continues to work closely with states. There's also the latest national strategy to scale up access to coronavirus disease testing in Nigeria. The World Health Organization has the latest updates. The live feed is the global response to the COVID-19 strategy. The website guides the public health response at both national and subnational levels. You can take a closer look at some of the numbers in real time. Also, our website, channelstv.com. It has more updates. You can find the latest on the pandemic in Nigeria and across the world, plus other stories. That is www.channelstv.com. Now, on a programming note, we will be bringing you a documentary on the life of elder statesman and former federal minister Chief Edwin Clark, as prominent Nigerians pay tribute to him. It's titled EK, the Quintessential Clark, a 90th Tribute. The documentary will air at 9 p.m. tonight in place of our COVID-19 update program. Well, that's the program now. Thank you for watching. I'm Millicent Wonka. Stay safe, stay healthy.